All right, now to this. The U.S. is encroaching on 4.3 million coronavirus infections. And the nation's top infectious disease expert says Americans should expect even more suffering in the coming months. Since the pandemic began, more than 148,000 people across the country have lost their lives. Just in the past week alone, the daily death toll has surpassed 1,005 times. But while the number of deaths continue to rise, the number of new cases seems to be slowing down. Yesterday, confirmed cases rose by 55,000, the slowest daily pace since July 7th. Still, hospitals in several states are overwhelmed with incoming patients maxing out ICUs. And while the nation waits for an effective vaccine, health officials are urging states to implement stricter safety measures. For more on this, let's bring in New York pediatrician Dr. Dyan Hes. Doctor, an ex-Obama health chief is claiming that the U.S. could, quote, virtually eliminate COVID-19 in a matter of weeks. How does he propose we do this, and do you think it's feasible?
Well, I think it's still going back to everyone wearing face masks, only leaving home when you need to, only outdoor activities 6 feet apart. It is feasible. Other countries have done it. Can you hear me? Okay.
Yes, doctor. Yep.
Okay. Other countries have done it, but I have to tell you, I live in Manhattan. I walked my dogs the other night and I saw restaurants open where you can literally reach from your table to the table behind you and take a piece of their food or grab a napkin. There was no 6 feet between the tables. They're not people. There should be fines. There should be stricter rules. It was so aggravating. I almost wanted to make like a 311 call. People are not following the guidelines. If you are allowed to reopen, you have to follow the guidelines. People are posting all over social media. I went into a restaurant, the wait staff wasn't wearing masks. It was too hot, So we're never gonna suppress this virus if people do not follow rules.
Yeah, I think it's a great point, Doctor. I've seen the same things that for a lot of restaurants, they sort of set up their tables and chairs on their patios or outdoor areas the way that they always have to maximize the number of butts in the seats. And you're not seeing tables that are 6 feet apart because that would mean far fewer tables. It's very frustrating to watch. I want to ask you about something else that the World Health Organization said. They warned that this pandemic, it's not about sort of waves, multiple waves. It's about one big wave, essentially. Accepting that, would that change the way we approach this pandemic?
Well, I think it's about resources. So when this first came out, when we didn't know how this virus would work, everybody thought, oh, when the summer comes, it's going to be better. Yet countries that were warm were still having massive numbers of cases. So that didn't really make sense to me, but that's what people were hoping. This is going to be like the flu. We're going to get a reprieve in the summer, and then we'll just have to worry when school starts again. But we haven't gotten a reprieve. If anything, it's gotten much worse. So we have to rethink that this is not going to, that's why we're talking about flattening the curve, because we have to keep the cases down, because it's always going to be prevalent and present until we have a vaccine or a cure. So there's no second wave because it never went away in the first place, especially in the United States.
The other big issue that people are talking about, Doctor, of course, schools. And as you know, classrooms across Florida are just weeks away from being forced to reopen. The time of uncertainty, of course, comes as the number of cases in that state and hospitalizations, especially with children, have surged there in Florida. I guess, I know we've talked about this, but what should teachers and parents do as they prepare for school? I've seen some videos of schools that are starting to reopen now, and they've got kids eating in the classrooms instead of the cafeteria. They've got little stars in the hallway where they should space 6 feet apart. But I wonder if that's enough. And it's great for the cameras when news crews are there, but especially little kids, it's got to be hard to, my brother's a teacher. He teaches 5th grade. It's a little different, but if you're in kindergarten or in preschool, it's going to be really tough.
Yeah, and also you have to wonder if the classrooms are air conditioned. So if you're in Florida and your classroom's not air conditioned and you have to wear a mask all day, how many kids are going to keep that mask on? How many teachers are going to be able to keep that mask on? I think the numbers, the way they are, Florida should not be reopening the schools. I think the prevalence is way too high in Florida. But I think that in states like New York and Connecticut, Vermont, where they were doing a great job, in the fall, they will be able to open the schools. Also, there's this rush to open the schools in Florida. Schools don't have to open in August. You can work it out for the safety of everybody involved, the teachers and the children, and postpone the opening of schools until September, till they get a better grip, or even mid-September. till they get a better grip on controlling this pandemic. These cases that we're seeing now didn't happen this week. This happened from irresponsibility of parents, of young people, people going to parties, adults. July 4th weekend. That's what we're seeing now. We're seeing all the repercussions. So this has to really be controlled, I think, in Florida and other states alike that have really high rates of spread and high prevalence among children.
Increasingly more and more, we are seeing that masks really make the difference. Initially when we were told to wear masks, it was all about protecting other people. It turns out we're also protecting ourselves when we wear masks. And when we all wear masks, it reduces your exposure to the virus substantially. What can you tell us about the importance of wearing masks? I don't know if there have been any new studies. What do we know?
Well, there's been many studies that the masks, definitely control the incidence of coronavirus, and we see it in countries like Japan, where mask, and in the Far East, where mask wearing is actually very culturally acceptable, and they've been doing it for years. So they've, like in Vietnam, places like that, they wear the mask and they keep the numbers down. But I think the best little case control study was, I think, out of St. Louis, where 2 hairdressers had COVID, and they saw 145 clients between the 2 of them. And the clients were masked and the hairdressers were masked, and no one caught COVID from the hairdressers. So here you have, the provider wearing a mask, the provider being the hairdresser, the client wearing a mask, getting their hair cut, and nobody contracted COVID. That means masks work when both parties involved are wearing masks.
You can't beat that. Dr. Hes, thank you very much.
All right. Be safe.